Welcome. There is no respite yet on the COVID-19 pandemic as the global infection toll gained by more than 200,000 on Wednesday to cross the 26 million mark. Recoveries are put at 17.3 million, while deaths are now over 863,000. Amid reports of a possibility of announcing approval of a vaccine before the end of October, the U.S. maintains its prime position on the top 5 list of most impacted countries with over 6.1 million cases. Brazil and India are number 2 and 3 with 3.9 and 3.8 million cases respectively. Russia is approaching the 1.1 million mark in infection toll, while Peru, which is relatively new at number 5, has over 657,000 cases. At home in Nigeria, the national toll is currently put at 54,463 after the emergence of 216 new cases. 1,027 deaths have been recorded, while recoveries is in sure stead at 42,439. Welcome once again to COVID-19 Myths and Facts. Nigeria is now transiting into the third phase of the national response for a period of 4 weeks, with effect from midnight on Friday, the 4th of September 2020. This was made known at today's briefing of the Presidential Task Force on COVID-19. The National Coordinator of the PTF on COVID-19, Dr. Sani Aliyu, revealed that the federal government has just adjusted the curfew from 10 p.m. to midnight through 4 a.m. nationwide. He adds that the NYSC orientation camps will open when tertiary institutions open, while amusement parks, gyms, cinemas can now open at half capacity. Civil servants below level 12 should remain at home, while private offices should determine optimal working capacity and time for staff. The Africa Centers for Disease Control and Prevention, Africa CDC, has provided an outlook on cumulative numbers on confirmed cases and deaths from COVID-19 on the continent.
Figures released by the center on Tuesday showed that the death toll from the ongoing pandemic had climbed to 29,833 across the African continent, as the number of positive cases rose to 1,252,552. Noting that 5 African countries account for over 70% of all COVID-19 infections, including South Africa, Egypt, Morocco, Nigeria, and Ethiopia, the Africa CDC also stressed that some 985,803 infected people had so far recovered across the continent. Amid the rapid viral spread, South Africa alone accounts for about 50% of all COVID-19 infections on the continent, followed by Egypt, which has close to 8% of all infections. And as the number of infections dips in South Africa and stabilizes across much of the continent, experts are coming up with different hypotheses on what could be responsible. These outcomes in infection toll have trumped all factors like crowded townships, poor hygiene, the impossibility of social distancing where large families live in single rooms, all deemed as tipping points during earlier months of the pandemic. Now here comes the hypothesis. Is there a link between poverty, crowded accommodation, and Africa's bafflingly low infection and death rates from the pandemic? What if poverty proves to be the best defense against COVID-19? These are at best hypotheses, but most scientists are at sea as to why Africa's COVID-19 numbers have remained low nearly 7 months into the pandemic.
And so we put these hypotheses before our guests today and see if we can come up with some credible explanations. Let's welcome public health expert Dr. Yemisi Soyombo. Thank you for joining us on COVID-19 Myths and Facts. So, Dr. Soyombo, yes, are you as perplexed as other public health experts from the Middle East and some in South Africa, where they're having a recovery rate, about the significantly low infection toll and death rate?
I wouldn't say perplexed. I'd rather say happy about this, even though there are no confirmed scientific reasons as to why this is happening. I'll say yes, Africa is vulnerable, but we're very much resilient, amidst all the other factors that we face or the things staring at us. So, I mean, it's true we have limited testing facilities, we have inadequate training, lack of availability of PPEs. According to WHO, our testing rates fall below standard, financial crisis. But amidst all of these factors, it seems like we have been able to pull through. Now, like you said, there's various hypotheses as to why, but there's a couple of other things we have seen that I personally feel have contributed to this. Let's take, for instance, the fact that most of the cases of the virus or positive cases were imported. So I think that the swift response of the government in locking down, banning international flights really did help because, I mean, if there was no way for the virus to be imported, then even though, yes, it could be spread from one person to another, I think that really helped. Another theory that I
That's
support,
interesting. That's interesting,
yeah.
Dr. Yemisi. Some are also saying, some scientists are saying that is it possible that that poverty that proved to be a problem, a crutch in the first place that could inflame infections, could it all now be the defense against COVID-19?
I wouldn't say poverty. I wouldn't give the credit to poverty. I would say maybe some other factors that come out of poverty, but not poverty, because we also have a young population as compared to continents in the world, as compared to other countries where you have increased cases. So the fact that we have younger populations is not accredited to poverty. Yes, I would say there are postulations that we have herd immunity, so that's where poverty comes in. So maybe the fact that, we cannot do the social distancing, we live in crowded populations, we live communally, yes, that might be attributed to poverty. But then again, some scientists have come up to say that we have built resistance or we have built some form of immunity because of our population, because of how we live in Africa, we have been exposed to flu, and maybe just by chance we have gained some kind of herd immunity. So not that we are not exposed to the virus or people are not contracting the virus, but we're stronger, we recover better, we have a younger population. I think those are clearer factors because no science, no theory has been able to directly point out the poverty as a strong reason why there's a reduction in the number of cases we're seeing.
So your own scientific postulation bothers a bit on herd immunity. But some say that African countries don't have a peak. Now, using Nigeria as an example, would you say that Nigeria has peaked, giving, the slightly low infection toll that the country has been experiencing in the last few days? Well, lower than what was turned out before then.
Yeah. I would say Nigeria has peaked. I'd rather say we should still tread carefully, especially now that there is an ease in the lockdown. We're going back to the normal. International flights are coming back. I think we should be careful. This is where we should watch out for a peak, because if we claim that this virus came in more from we were imported, then now there's a possibility and there are chances that there might be a peak because we're going back to schools, we're going back to the markets. I mean, I understand the economic factors, but now more than ever is when we should be careful. So I wouldn't say we have gotten to a peak. I think we should still watch closely. We should tread carefully.
So we should exercise caution. That's instructive.
Yes.
Now, one of the questions, Dr. Yemisi, that is being asked in America is that should we believe the mortality statistics, given that a lot of death certificates say that there were other inherent, sicknesses and debilitating health conditions. Now, if we broaden the horizon of that question, should we ask the same about Africa? Should we take a second look at the death statistics?
Very true. Very true. I think we should take a second look, maybe a third look at our death statistics. Just like we've seen in other climes, there have been pre-existing conditions. Remember that assessing care during this whole period, assessing health care for other conditions was also a challenge. So people with chronic diseases as well, diabetes, hypertension, had challenges assessing care. So I would say this data should be looked at. I think I won't really trust those data. Apart from that, remember that we have limited testing facilities, and we have, as Africans, we have a negative mindset about going to the hospitals, or even there's some kind of stigma when you are suspected to have COVID.
True.
So COVID-19, sorry. So I think that I wouldn't really hold those data. I mean, data is also a problem to us here in Africa, getting the data, assessing the data. So I wouldn't really trust those records. I think that they might even be more.
All right.
Yeah.
Dr. Yemisi Soyombo, public health expert, we thank you for your contributions on COVID-19 myths and facts on TVC.
Thank you for having me.
And as we wrap up here, we hope that Africa's impressive performance in tackling COVID-19 stays this way. That's our package on today's edition of Myths and Facts. We thank you for watching. Remember, whatever you do, stay informed and stay safe. Bye for now.